We're trying to get insight and perspective from people on the front lines of this public health crisis. Tonight, we're talking with Marna Borgstrom. She is the CEO of Yale New Haven Health System. And thank you so much for being with us tonight.
Thank you for asking me.
My first question is, how is everyone in the Yale system doing in this fight right now?
I think our employees and the medical staff are just doing a fabulous job. The people that I'm most grateful for are the people who show up every day and give our patients and the people who love them the best care that they can.
What are some of the biggest challenges?
I think the biggest challenge for healthcare workers is a challenge for everybody, and that's fear, not knowing how this virus is really going to spread, whether or not they're going to be exposed. But I think when I talk to people and you get these patient stories, caregivers feel so inspired taking care of the patients they're given the responsibility for, that sort of transcends the fear. And, and I think that people just show up as their best selves every day.
So many people think that right now the hospitals are just overwhelmed with COVID-19 cases, but there are still some people coming in to have babies and cancer surgeries and things like that. What kind of message do you have to the people who have to come into that hospital and not be treated for COVID? Because they're kind of concerned.
Well, you know what? People are still going to have babies, as you said. People are unfortunately going to have coronaries and strokes. And, this is still the place they should be if they need to. I mean, one of the things that we have all seen in this field is since the coronavirus, the emergency department is less busy than it's been in months. But the people who are in the emergency department are really sick and they need to be there. And we've cohorted coronavirus patients on specific floors. And if you come in with a stroke or to have a baby, you're not going to be anywhere near those patients.
How long does a person, I realize every case is different, but if somebody comes in with COVID-19, they're admitted to the hospital, they're pretty sick, how long do they end up staying there? And what happens if they have to go on a ventilator?
So it really depends. There are people who come in and remain on an acute medical surgical floor, may have nasal oxygen, but don't require ventilation. And their length of stay may be just a couple of days. And then there are people who need ventilation. And some of those people end up being in the intensive care unit for 14, 16 days at a time. What we're increasingly seeing, though, is they're using a little less of the ventilators, and they're putting patients on what they call high flow oxygen through nasal cannula, and that's shortening the ICU length of stay a little bit.
So there are some hopes there. All right. Marna Borgstrom from Yale New Haven Health, we appreciate you joining us tonight. Thank you for your time.
Thank you very much.